Hi, my name is Tammy. I'm going to talk to you about how to care for a patient with a catheter. So a catheter is inserted into the person's bladder, and that's just to drain urine if they can't pass urine in the normal way. Sometimes it's temporary, sometimes it's longer term. It's a tube that has holes in the top, and that fits into the bladder, and then it's filled with a balloon of sterile water, usually 10 mils, and that way that then sits in the bladder and it won't come out. So I'm just starting work for the day, and my patient Horatio's got a catheter, so I'm going to care for him from morning down to the evening. Okay, so first things first, I need to check what he's drained in his night bag, which is just this one, and I'm going to empty that so that when I'm helping him with a wash, I'm not going to pull on anything. So this holds 2 litres, and it's just put on at night time. I'll show you how to change the bag to a leg bag afterwards. It's just got a switch that you flip down there, and then when I want to close it, I can just flip it back towards me. Okay, I'm going to record that onto Horatio's fluid balance chart. I just use an alcohol sani cloth, give that a wipe, and then pop it back in the holder. I'm just going to dispose of this. So I've covered Horatio up just to protect his privacy and dignity, and I'm going to give his catheter a little clean. I wash my hands beforehand and I wear my PPE, so I'm ready to go. So just using some hot soapy water and some washcloths, I'm just going to wash down the tube, just wash down the tube just towards the bottom and dispose of that in the bin. And with another cloth as well, just washing down from the tip of the penis down towards the bottom. I can then clean around the actual area that's been inserted. And obviously with a male catheterised, just make sure to clean under the foreskin as well. And that could just pat dry downwards on the tube. Okay. So I want Horatio to mobilise as much as possible, getting back to his independence, and I'm going to change him over to a leg bag. When changing it over, it tends to leak a little bit of urine, so I'm going to use an Inco sheet just to help. Leg bags just hold 500 mils, and it's this bit here. So if you just twist that, and then I can just pop that onto the leg bag. So this is a night bag, and I'll just put the cap on that just to keep that nice and clean for now. Okay. His leg bag I'm going to fix down on the lower part of his leg. Some of them are shorter catheters, so they do go further up. I think it's patient preference, but the ones we tend to be on the lower part. That way you can wear trousers and you can use the valve at the bottom and just empty it yourself. So the straps have gone through, and I've been careful not to put the straps on top of the actual catheter. And then there's just a Velcro bit there, which I won't do because his leg's heavy. And then the bottom strap I'm just going to pop on, again avoiding the tubing so I'm not restricting the flow. So that's his leg bag. If you did want to connect it straight to the bed bag at night time, you can pop that on and flip the valve down so that the urine can drain straight from Horatio into his leg bag and then into the night bag. Okay. So Horatio's unwell this afternoon and we've had to attach a urometer. If someone ever asks you for your hourly urines, then this is what they're looking for. So the bag here runs into a chamber first and foremost. So there we can see he's had about 85 mils passed in that 1 hour. So I would then empty that chamber into the catheter bag, like that. When it comes to drainage of the catheter bag, I'm going to use a sani cloth, and if I just basically unclamp these clamps here and pull down, and then just unclamp this metal bit and clean before and after.